Congratulations! The time is coming close to when you will welcome your baby into the world. This video will guide you to the relevant areas of the hospital that you will experience on your journey. The delivery suite and maternity ward are located on level 4 of the main hospital. These areas have restricted access and can be accessed by ringing the bell on the intercom. Please telephone the delivery suite at 071 917 4676 before you arrive at the hospital. This is the delivery suite, where 1,400 babies are born every year. We advise that one birthing partner accompanies you to the labour ward. Always bring your maternity chart to all hospital visits. This unit consists of an admission area or assessment room, bath and showering facilities, we also have a comfortable 2-bedded area for induction of labour or early labour. There are 3 birthing suites. Each birthing suite contains a birthing bed, a cardiotocograph monitor to monitor the baby's heart rate, a resuscitator. This is used if your baby requires additional care, for example oxygen, a trolley, including a birth pack, Antenatal, which is a gas used for pain relief in labour, drip stands for intravenous fluids. TENS machines can be rented from a local pharmacy. Please ask staff for details. All options of pain relief are available, and your midwife will guide you through all of your choices. Hydrotherapy, or taking a bath, is an excellent form of pain relief during early labour. This is recommended if your membranes are intact, if your waters have not yet broken. The bath is situated at the end of the corridor. Antenatal. Piped Antenatal is available in all birthing rooms. Pethidine. This is a narcotic once-off injection that is frequently used in conjunction with Antenatal. Epidural. This is cited by an anaesthetist in the birthing room. Written consent prior to the procedure is required. Birthing balls and cub supports are also available. CUB stands for Comfortable Upright Birth, and this is now accepted as the modern birthing stool. Now we will show you various positions for labour and birth. Being active and remaining upright during labour can distract you from any discomfort you may be feeling. When you are upright, your womb tilts forward during contractions. This means you will have better contractions and less pain. Contractions are stronger and more effective when you are upright. This could mean your labour is shorter. Gravity will help your baby move down the birth passage. Pregnant women who are upright and active tend to need less pain relief or interventions to get the baby out. Your baby will get a better oxygen supply and will be in a better position. The lower part of your spine can move better when you are upright. This means the birth canal can widen and make room for the baby's head. Pelvic joints can expand and move, which means less pressure on nerves. Midwives actively support women who choose hypnobirthing or other complementary therapies during labour. immediate skin-to-skin and early breastfeeding are encouraged in the delivery suite. If you have an epidural, you can still take advantage of the effect of gravity by altering the position of the bed to help you stay more upright and lean forwards on a gym ball, gently rocking forwards and backwards. A number of women will experience caesarean birth. This birth takes place on level 8 in the operating theatre. A midwife will accompany you and your birth partner to the operating theatre, supporting you through this birthing experience. The postnatal ward is located on the same corridor as the delivery suite. After the birth of your baby, your midwife will accompany you and your baby to this ward. The midwives on the maternity ward will offer all the help, advice and support you may need to care for yourself and your newborn baby. At Sligo University Hospital, we actively encourage and support breastfeeding. NICU, or Neonatal Intensive Care Unit. If your baby needs specialist care, they will be cared for in the Special Care Baby Unit, known as NICU, where you or your birth partner are welcome to care for your newborn baby. We ask you to observe hand washing policies and restrict visitors in this area, as your baby may be vulnerable to infection. Partners may visit the postnatal ward from 9 a.m. to 8:30 p.m. daily. Grandparents and siblings of the newborn may only visit between 6:30 p.m. and 8:30 p.m. No other visitors are allowed except in exceptional circumstances. This is at the discretion of the clinical midwife manager or midwife in charge. We aim to provide you with a positive birthing experience and look forward to welcoming you to our hospital. The delivery suite can be contacted at any time to answer questions regarding your pregnancy or labour. Please phone 071 917 4676.
Hello, welcome to Sligo University Hospital. My name is Juliana Henry and I am the Director of Midwifery. We're delighted you have chosen to have your baby here with us. All of our staff are here to help and support you to have a positive pregnancy and birthing experience, and we look forward to meeting you.
Gestational diabetes is one of the most common health problems that can happen during pregnancy. It affects as many as 12% of pregnancies in Ireland and can lead to serious problems for both mum and baby. Certain women are at higher risk of developing gestational diabetes. For example, if you are overweight, if you have a family member with diabetes, if you had gestational diabetes in a previous pregnancy, or depending on your ethnic background. If you are at risk, you will receive a blood test for gestational diabetes between 24 and 28 weeks of pregnancy. If you are diagnosed, there are day-to-day changes you can make to stay healthy. How much exercise you get and what kind of food you eat can have important effects on your health and your baby's health. But what happens when you have gestational diabetes, and how can diet and exercise help? Food and drinks are broken down in your digestive system. The sugar they contain is absorbed into your bloodstream. But sugar needs insulin to work. Insulin is made by the pancreas and helps sugar get into your cells. Insulin acts like a key that lets the sugar move from the bloodstream into the cells of your body, where it is used for energy. Pregnancy hormones change the way insulin works in your body. In the later stages of pregnancy, these changes make it difficult for insulin to unlock the cells and allow the sugar to enter. This is what is known as insulin resistance. Some insulin resistance is normal in pregnancy, but this means that your pancreas needs to work extra hard to keep blood sugar levels in a healthy range. When you have gestational diabetes, your pancreas is not able to keep up. As a result, too much sugar is left in the blood. However, a carefully planned diet with high-fibre carbohydrates and no added sugar can make it easier for your body to manage the sugar in your blood. Exercise will also help keep blood sugar low, as it improves insulin's ability to unlock the cells and uses up sugar for energy. If blood sugar is controlled, your chances of a healthy pregnancy are the same as a non-diabetic mum. This makes diet and exercise powerful tools for a healthy pregnancy. However, if blood sugar is not well controlled, this can lead to problems in both mum and baby. In a study of 23,000 pregnant women around the world, researchers found a link between high blood sugar in mum and babies that had grown too big. Researchers also found a link between high blood sugar and preeclampsia, premature delivery, need for caesarean section, birth injury, and abnormal sugar control in baby. Diabetes during pregnancy can also put you and your baby at risk for problems later in life, including type 2 diabetes and heart disease. But there are actions you can take. Changes in diet and exercise, combined with close monitoring, can successfully manage blood sugar in 7 out of 10 pregnancies. So no better time to start than now. To learn more about Irish research on maternal and newborn health, you can visit the HRB Mother and Baby Clinical Trial Network's website.
Hi everybody, I'm Marie Byrne. I work in Sligo University Hospital as the perinatal mental health midwife. So let's talk about your mental health after having a baby. Okay, so how common are perinatal mental health issues? Well, 1 in 5 women will struggle with their mental health around this time. First of all, just to be clear, anybody can suffer with mental health during their pregnancy, but you can be predisposed, okay? So let's identify some of the contributing factors, okay? So maybe number 1, you might have had a previous mental health problem, episodes of depression in your past, anxiety, OCD, eating disorders, or maybe you've had an episode of psychosis in the past. That would inform us that you are predisposed this time. Biological issues, anything like sleep, diet, IVF, a difficult pregnancy, pain, anything like that can trigger your mental health to deteriorate. Emotional causes, a breakup of a relationship, a major life event, losing somebody, excessive worry, lack of support, lack of family, lack of friends. It's kind of a vulnerable time. You need these people in your corner. Difficult childhood experiences, so maybe you've had an episode in the past of trauma or abuse and something could come up for you this time. If you've got low self-esteem as well, you may feel that you're not going to be a good mum, and that can feed into the negative thoughts. Stressful living conditions, living in poverty, addiction, overcrowding, maybe a domestic violence scenario, unable to advocate for yourself. So if you're not able to talk up for yourself, and it's not just us, it's dads too. So 1 in 10 dads will experience depression during their partner's pregnancy. And when a woman has postnatal depression, maybe 20 to 50% of those dads will also have depression. So it's just good to make you aware of that. Now, just to acknowledge, guys, that most mums struggle to adjust between pain, sleep deprivation, the hormones, the baby blues, the whole lot. These things trigger depression. So if you are crying every day, if your appetite is off and you're sleeping really badly, or you've become super anxious about the baby, your mood is low, you're feeling overwhelmed, for a week or so, you know you may be in trouble. So at that stage, go down to your GP, you may have postnatal depression or anxiety, and it's kind of the same coin, you know. Struggling with your mental health does not make you a bad mum. Be aware of your own risk factors, okay? Discuss your issues honestly with your partner, with your family, your friends. The more people that know, the better. And with that, the care providers, so your midwives, your GP, your PHN. And let's normalise mental health, otherwise we won't ever rectify it. Get help at home as soon as you can. Delegate, make plans, put things in place early if you can. If you're prescribed medication, get them, take them, and come off them a number of months later on. Don't let yourself deteriorate. Recognise your own strengths, your own resilience, your own resources, your coping strategies, what's worked before for you in the past. Locate a tribe, so a toddler group, a baby swim group, the library, a yoga class, whatever is local to you, just that you've some part of the day that's your own, okay? And it takes a village to raise a child. And last word, 1 day is okay, 1 week is not, okay? Thanks everybody for listening. See you soon. Bye-bye.
Hello, my name is Sinead Thompson and I'm a community midwife at the National Maternity Hospital. I designed and created labour hopscotch in 2015 in response to an increase in the epidural rates and also in medical interventions during labour and birth. The principle of labour hopscotch is to encourage optimal fetal positioning. This means having your baby's head in the optimum position, lined up so it can descend into the pelvis in the optimum position for labour. When this happens, it triggers the spontaneous onset of labour. When women go into spontaneous labour, it's less likely that they'll need induction, and that means that there'll hopefully be less intervention in their births. The labour hopscotch framework aims to support and promote natural and active labour. It is encouraged for all women, regardless of the care pathway that they choose for their birth, but encourages more natural methods of pain relief where possible, for as long as possible in labour. Using the idea of the game hopscotch we all played years ago, each of the steps can be undertaken to remain active during labour. The process can start at home, beginning at the bottom of the hopscotch board when you're more active and mobile. The bottom square of the labour hopscotch is called the mobilised square, and it aims at promoting optimal fetal position. There are 4 activities associated with this step, and it's important that these 4 positions are practiced throughout the antenatal period in preparation for your labour. Your midwife will explain the positions to you during your pregnancy. Our research findings, which we published in 2019 in our research study, showed that women who practiced labour hopscotch had reduced epidural rates, reduced the caesarean section rates, increased spontaneous onset of labour and vaginal deliveries, and most of all, there was an increase in birth satisfaction rates. Having a positive birthing experience makes a smoother transition to parenthood.